welcome back to our next episode of the Hormone Café. Today we're going to talk about something that I hear often, which is what to do when everything comes back normal. Because sometimes you've gone to a number of different doctors, you have been diagnosed with PCOS, or you're feeling bad, or your cycles are irregular, or you haven't been able to get pregnant, and you do some labs and you do some testing and they tell you, oh, everything's normal. We don't know. But it's really frustrating to hear that because you don't feel normal, right? You don't feel good. You're having a period every 3 months, or you're having a painful period, or you're not able to get pregnant. So I'm going to walk you through one of the patients that I took care of as a patient case and some of the tips that we can do when we're doing these tests and everything's coming back normal. So my patient, Jessica, she's in her late 30s. She came to me and she'd been trying for a year and a half. Her story is that she was on birth control when she was younger. She came off of her birth control and then she had her first baby and then she had her second baby and she had no trouble conceiving her 2 babies. And then she really wanted to have a third kiddo and they had a lot of trouble trying to conceive their third kiddo. And she had regular cycles. They were every 28 to 30 days. She was bleeding for 5 or 6 days. So she went to a fertility clinic and she had an ultrasound and she had blood work and they told her everything was normal. So she tried letrozole for a few months and she ended up doing 2 rounds of IVF. So she did a round of IVF and she was told that they couldn't implant the embryo, and then she ended up getting pregnant naturally and she had a miscarriage, so she had to have a D&C. So then she did another round of IVF and then she ended up getting pregnant again and she ended up having a chemical pregnancy. So multiple miscarriages, multiple rounds of IVF, and she was told, we don't know why it's working, everything looks normal. When I talked to her, she's had a history of really significant constipation. Sometimes she was having bowel movements once a week and she would get so constipated that she would throw up. And even after her IVF cycles, she said that her cycles were back to regular. They were still every 28 to 30 days. However, after her D&C, she's been feeling a bit different. She's having this pain in her right lower quadrant all the time, just like a dull ache. Nothing makes it better or worse. She feels worse going into her period. So then she went to her regular OBGYN and they put her back on letrozole. She did multiple cycles of letrozole and she felt okay, but she still wasn't getting pregnant. She had had an endometrial biopsy. She had had a normal hysterosalpingogram, which is a fallopian tube dye test. So her fallopian tubes were open. Her husband did a semen analysis. Her egg quality was normal. She said that her autoimmune and thyroid panels were negative. And she had been on some progesterone in the past and it made her feel bad. So she came to me with this history where she had had 2 kiddos easily and then she felt like everything was broken and everything was wrong, but the tests kept coming back negative and she couldn't figure out what's going on. So when we did a full hormone profile on her, it turned out that she has low estrogen and low progesterone. So when we're thinking about ovulation medication like letrozole or Clomid, you don't want to start those medications unless you have an excellent hormone profile first, because the way that letrozole and Clomid work is they help your body, or they tell your body to make more estrogen and progesterone. But if you don't even have the nutrients to make enough estrogen and progesterone, you don't even have the building blocks, then those medications aren't going to work for you. So it's really important that we dig to the bottom and figure out why you have low estrogen and progesterone levels and then fix those things before we start an ovulation medication. And if you really have to pay attention to your estrogen and progesterone ratios. For example, if you go on progesterone and it makes you feel bad, then something's wrong. That's not the right thing for your body. And her problem was that her estrogen and her progesterone were low. So if you just start someone on progesterone, but your estrogen's really low, you're really not going to feel good, okay? So when we think about why hormones are low, when one problem that she had is that she was only having a bowel movement once a week. And so if her gut is really, really off, she's literally not going to be able to resorb the nutrients needed in order to have the building blocks to make estrogen and progesterone. So sometimes gut work can take a really long time. So while we're working on the gut, we can do things like add in supplements or bioidentical hormones to really rejuvenate our hormones along the way. So we started her on a supplement called DHEA to help her estrogen production. And then we started her on bioidentical estradiol and bioidentical progesterone. And then because she was having these pains, we did a vaginal swab on her and she was diagnosed with ureaplasma. And she said, well, why hasn't anybody else found that I have this vaginal infection? And sometimes you just have to do the extra test. So she and her husband both took an antibiotic called doxycycline, and it really helped with that pain that she was feeling. And then we reran her autoimmune panels because sometimes if everything is seemingly normal, but it's not making sense, it's helpful to run it again. And she actually had a positive ANA that was really high. So I don't know why she was told that she had a normal immune panel, because she actually had a lot of inflammation in her immune panel. So we started her on anti-inflammatory medications and an anti-inflammatory diet. So we put her on prednisone and hydroxychloroquine because our autoimmune markers were really high. And then I had her do a gut health test, and her metabolic imbalance was 10 out of 10. So, which is bad. 10 is the worst, 0 is the best. So the way that she was digesting her food and the way that her microbiome was really, really, really off. And she had elevated beta glucuronidase, and she actually had a gut infection. So she had something called Enterobacter, and then she had really, really, really low fiber. And she was thinking, how do I have low fiber? I literally have a smoothie every single day and I put fiber into it. But a lot of times if you have low fiber, you just need a lot of diverse fiber sources. So because her gut was so bad, we had her take some antibiotics to kill off her gut infection. And then I had her take supplements in order to help her beta glucuronidase levels, because that is what helps recycle estrogen in your gut. And then we had her take a probiotic and a prebiotic, because prebiotic is fiber. And then we literally designed a diet for her in order to regrow her healthy gut microbiome and have her get more fiber, because you need a lot of fiber diversity, right? You need soluble and insoluble fiber. And even though she had had an endometrial biopsy before in the past, I always like to repeat it, because when I do an endometrial biopsy, I send it for the health of the cells. I send it for stains to check for endometritis. I send it for a culture and white blood cells. And she was actually diagnosed with a polyp that wasn't caught before. And another thing that I always bring up with people, especially if you've been trying for more than 6 months, and if, quote, everything is coming back normal, it's always important to check for endometriosis. So we ended up doing surgery on her, and she was diagnosed not only with endometriosis, so we removed the endometriosis, removed the polyp, but she was also had a really significant pelvic venous congestion syndrome, which is where you have really dilated pelvic veins. And that, in addition to the endometriosis, was really contributing to that pain that she was having. So when we think about pelvic venous congestion syndrome, we really want to think about doing pelvic floor physical therapy to really make sure we're improving the blood flow in our pelvis, right? Because if we're not getting good blood flow through our pelvis, we're not going to get good blood flow to our uterus and to our ovaries, and that can cause a lot of this like dull, achy, chronic pain. So after doing all of these things, right, working on her gut, making sure that she was eating enough fiber, getting her to have a bowel movement, fixing a lot of her inflammation, both from an autoimmune source and from endometriosis, working on her pelvis venous congestion syndrome, fixing her low estrogen and low progesterone, fixing her ureaplasma. I mean, think about all the things we did. This is a person who came and she had all these tests and seen multiple doctors and multiple rounds of IVF, and everyone kept telling her that they don't know what's going on and that everything looks normal. So 1 month after surgery, she was pregnant. She had a positive pregnancy test, and she didn't have to take any fertility medications. She didn't have to take letrozole. She didn't have to take Clomid. She didn't have to do a trichia shot, anything like that. And she had a very, very healthy pregnancy. And she came to me postpartum, and she has a sweet, sweet little baby girl. And I think one of my favorite parts of that is that she came to me and she said, oh my gosh, Dr. P, I'm literally pooping every single day. I'm so happy. I've literally only pooped once a week for 10 years. I didn't know that it wasn't normal. And my poop is so amazing. I feel great. And it was just funny to hear her talk about how amazing her bowel movements were and that she was feeling great and having a great bowel movement every single day without having to take a bunch of laxatives. So sometimes when everything is normal, here's some kind of principles that we want to think about what to do. Number one, sometimes it's helpful to run the test again to make sure nothing has changed over time, because a lot of people come to me and they're like, oh my gosh, I've had so much blood work done. Like, do I really have to get my blood work done again? And I totally get it. I hate getting my blood drawn. I'm a total wimp. I really don't like getting my blood drawn. But one of the things that I see is that sometimes there can be changes over time in your blood work or your tests, and it is helpful to get multiple data points to see what things are doing over time. Or sometimes people didn't run complete panels. For example, you want to make sure you run a complete thyroid panel, and you want to make sure that you run an adrenal panel, and you want to make sure you check a complete vitamin or nutrient panel. So it's helpful to sometimes do a little bit more complete panels than you might have had done in the past. And then also the timing is really, really important. So sometimes people get their hormones drawn, but they just get them drawn at the wrong time in their cycle, and they were told everything is normal. But when we do a couple more data points, it turns out that it actually is not normal. Okay. So just make sure that it is helpful sometimes to run the tests again. So for example, she had a normal endometrial biopsy in the past, but when we repeated her endometrial biopsy, it turns out she had a polyp that they didn't catch the first time. And then I think the other thing that's really important, number two, is to listen to your body and test based on your symptoms, okay? So if you're a person who's been told everything's normal, but you've had 2 miscarriages, right? So then we want to really focus on our miscarriage testing. If you have a lot of fatigue, then we want to focus on what are the things that could be making you tired, okay? If you're having abnormal bowel movements, or you're only pooping once every few days or once a week, then we need to do gut testing. So when you're hearing that everything is normal, sometimes it just means that we have to retest or test at the right time, or do a little bit deeper digging. And the number one most important thing is to listen to our bodies. They'll tell us what's going on, and then we can target our testing based on what our bodies are telling us. So if you're a kind of person where you're in that camp, you've done all this testing, you've been told everything is normal, please do not hesitate to contact us. Our whole goal is to do a lot of digging and really make sure we're finding out everything that we need to about your body to make you healthy and whole and feel amazing. Thank you so much for joining us on this episode of the Hormone Cafe. Please stay tuned for our next episode.